All right, welcome everybody. My name is Nathanael Mathew. I'm a freshman at Rice University here in Houston, Texas. I used to be a HOSA kid. I went to Alvin ISD, and so I know that having guest speakers is something that HOSA does a lot. And so I'm really grateful for this opportunity to do this. Thank you for everyone at the school, post officers for allowing me to do this. And today we're going to be talking about lung cancer and lung cancer screening and why it's really important. And if you have any questions, feel free to put in the chat. And at the end, if we have some time, I'll try to allow you to unmute yourself. Let's go ahead and get started. Right, like I said, before we get started, I'll take questions at the end, but if you do have questions, you can put them in the chat as well. And here are some of the websites from the organization that I'm part of, ALCSI, if you'd like to look into that as well. So what is ALCSI? Essentially, ALCSI is a 501c3 nonprofit. So it's an organization working across the United States with doctors and students, working with the community members to make sure that people can understand more about lung cancer screening and why it's important. I am part of the Rice University chapter of ALCSI. And so me, along with my fellow officers, try to make sure that we reach out to the community and help people understand about the risks of lung cancer and why it's important to get screened when you should. All right, let's get started. So to start things off, we need to talk about lung cancer, right? It's really common. It's the second most common cancer in the US, excluding skin cancer. And this graph shows that the American Cancer Society actually estimates the number of new cancer cases in 2022 for the 4 most common cases of cancer, with lung cancer having the predicted rate of 236,740 people. So what does that mean, right? To put it in perspective, we can think about 6% of people will develop lung cancer during their lifetime in the US. So 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. And sure, it's common, but what's even worse is the fact that it's really fatal. It's actually the leading cause of cancer-related death in the US and the world. And in 2022, it's estimated that 130,180 people will pass away due to lung cancer. And you can see that here. It's actually more than if you combine breast, prostate, and colon cancer altogether. Lung cancer actually makes up 25% of all cancer deaths, and that results in 350 deaths each day. And if you think about breast cancer, there are 50,000 more new cases of breast cancer every year, but lung cancer causes over 90,000 more deaths. So this is a huge issue. It's always been a huge issue. And if we look at demographically, we see that lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males at an incidence rate of 71.7 per 100,000. Among females, lung cancer incidence is highest in white females at an incidence rate of 51.1. And mortality rates mirror incidence rate. So from this data that we see, we can think about the question, why exactly is lung cancer mortality so high? And the reason is because people are often diagnosed at a later stage. So let's try to understand that. If we look at these 2 charts, we see that the 5-year survival rate for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And it makes sense that if you're at a distant stage, you have less likely chance of survival. So that's why early detection of lung cancer is so important. If we can detect it earlier on, we can make sure that we have better treatment options and prognosis will hopefully be better. So you're thinking, okay, lung cancer, what exactly are the symptoms of those, right? What things do you exhibit that kind of point to the fact that you may have lung cancer? And it's not very clear cut, right? So, well, the majority of patients are diagnosed with lung cancer stage, late stage lung cancer, because they don't feel any of the symptoms of lung cancer until the cancer has grown and spread. And the most common symptoms of lung cancer are chronic cough, coughing of blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent low respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it is more difficult to treat and the prognosis is poor. And if we wait to diagnose patients until the symptoms are really showing, it's difficult to catch lung cancer early. So the question that we have is, how can we catch lung cancer before it becomes, before patients are actually symptomatic? And the best way that we can do that is through lung cancer screening. And lung cancer screening is actually done using something called the low-dose computated tomography scan, right? Or low-dose CT scan. If you're eligible for lung cancer screening, This is the recommended way that you get your annual lung cancer scan. So in the coming slides, we're going to be kind of talking about what exactly does this mean, what exactly is low-dose CT, and how exactly you can get screened. So I want you to look at this image and try to figure out where the cancer is, right? It's where the arrow is, right? You can kind of see that white blotch on the low-dose CT scan, where that cancerous tumor is. And if we look at the low-dose CT scan, that's very, very obvious, whereas the chest X-ray, it's not that as obvious. And the question that researchers really wanted to answer is, how effective is low-dose CT scan in detecting lung cancers at an early stage? And they ran something called the National Lung Screening Trial, or the NLST, to answer this question. So just as a recap, we're using low-dose CT scans to screen for lung cancer, not chest X-rays. So we look at this trial that I mentioned, right? The NLST. It was a large study with over 50,000 patients. And the goal of the study was trying to figure out how effective is low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. The study had two groups, right? It had a group of patients who received annual low-dose CT scans, and then a group who received an annual chest X-ray. And by comparing the stages at which cancers were caught between the two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. And what they found was interesting. Everyone diagnosed with lung cancer, as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at the early stage, while the X-ray diagnosed more patients at stage 4. And this has important implications for survival. Right? The chest X-ray is definitely a very important part of the medical system. But because a low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable and the prognosis was much better. And this translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. So one thing with any screening, but especially with cancer screening, is how accurate this is, right? How good is a low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung screening, 75 will be negative. And of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who don't have lung cancer. So if you don't have lung cancer, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. Let's say we move our attention to the 25 individuals that are positive. It turns out that 23 turn out to be negative for lung cancer, primarily with follow-up imaging alone. This means that even if your test result is a false positive, it's easy to rule out cancer using further non-invasive imaging. And the two individuals that have positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they weren't able to undergo that lung cancer screening. This means that their treatment options and prognosis is way better. And the results of the NLST was published in 2011, and that was 11 years ago. And after that, a lot of studies have further confirmed this. And one of the most important studies is the Nelson trial. So in February of 2020, the results of this trial were really published. And also there were two groups, but unlike the NLST, this trial, the Nelson trial, had a group that received low-dose CT scans and a group that received no screening of any kind, almost sort of like a control. And there were more than 13,000 men and more than 2,500 women between the ages of 50 and 74 that were randomly assigned to undergo CT screening at the baseline year, 1 year, 3 years, year 5.5, and then no screening. And the results actually confirmed the life-saving benefits of lung cancer screening by low-dose CT scan. In the screening group, 58.6% of lung cancers were diagnosed at stage 1. And in the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. And we know that early detection translates to a reduction in mortality, right? Less people die if they get detected early on. So in the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. And this Nelson trial also showed that with the improvements in low-dose CT scan, the false positive rate was reduced significantly. So now the question is, all right, we know that lung cancer is a problem. We know that screening is really good for detecting lung cancer, but who should get screened? And the truth of the matter is there are three main considerations when talking about screening guidelines. And this is put out by the United States Preventative Services Task Force, UPSTF. And right now there are three things. the ages of 50 to 80, 2 have a 20-pack-year smoking history, and 3 a current or former smoker who's quit within the past 15 years. And these are the individuals that really are recommended to get the annual low-dose CT scans. Now, one thing that you might notice here is the term Pacquiao, right? It's something that you've probably never heard before. And basically what that means is it's essentially a way to figure out how much smoking an individual has done, right? So a pack year is defined as smoking a pack of cigarettes, one pack of cigarettes per day for 1 year. So if you were to smoke 1 pack of cigarettes every day for 20 years, that would be 20 pack year smoking history. And if you smoked 2 packs a day for 10 years, that would also be 20 pack year smoking history. And so the essential idea that we're trying to get out is there are many different ways they can reach 25 years, and it's just one way for doctors to figure out who is recommended to get lung cancer screening. Now, smoking is the most common cause of cancer, and it's the primary risk factor. And when you actually compare people who have never smoked cigarettes, a current smoker has 25 times greater risk of lung cancer, and about 8 out of 10, or around 81% of the deaths from lung cancer are expected to be caused from smoking cigarettes. And this is huge, right? So cigarettes is a really big problem when we're thinking about lung cancer. But after smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and actually can build up indoors. And secondhand smoking actually causes almost 3% new diagnosis of lung cancer, and it's expected to cause about 3% of deaths from it in 2022. There are additional risk factors: asbestos, family history of lung cancer, COPD, and previous radiation to lungs. And so it's important that we look at these additional risk factors, because even though we often associate smoking and lung cancer together, there's a large number of people in the United States who have never smoked but still get lung cancer. And so if we look at the data here, let's define never smokers as people who have smoked less than 100 cigarettes in their lifetime. And because lung cancer has a strong association with smoking, people are often surprised to see that about 10 to 20% of lung cancer diagnoses actually comes from never smokers. And it's the 8th leading cause of cancer-related death in the US and the world, if we look at it independently. More people who have never smoked die from lung cancer each year than people die from ovarian cancer. And the graph actually shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are a current smoker, a former smoker, or a never smoker. And you can see that 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. And so if you look at it, you can really see that there is a serious problem in smokers for sure, but also in non-smokers. And that's why the importance of understanding the issues of lung cancer even comes more to the forefront. So right now, lung cancer screening isn't recommended for individuals that have never smoked, but it's still important to understand that. And that's an area of future research that we're definitely looking into as a society. All right, so let's go ahead and summarize this all together. Lung cancer is the leading cause of cancer-related death in the US. It's so deadly because of the fact that lung cancers are often caught too late in a later stage when they've often spread, making them even more even more fatal. And early detection through lung cancer screening by the use of low-dose CT can actually reduce lung cancer mortality by up to 33%. So this is huge. Lung cancer screening is definitely something that we should be doing. But let's look at the statistics. It turns out that only 5.7% of high-risk individuals are currently getting screened for lung cancer. And to highlight this, you can see how much that compares to other cancers like breast cancer screening, cervical cancer screening, and colon cancer screening, which are all important things to do, but notice how little attention is placed on lung cancer screening. And this is extremely low. If every person that fell under the guidelines of the United States Preventative Services Task Force actually got screened, we could save 48,000 lives. But right now, only 5.7% are being screened. And a lot of lives that could be saved are not. And now the question comes, all right, we have the screening technology. Why exactly aren't people getting screened? And it comes down to a couple of different factors, including cost of screening, access to screening centers, the safety of the screening, and limited awareness. So if we talk about how do we pay for screening, The average low-dose CT scan costs anywhere between $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. And there are a few exceptions. One, Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening. And finally, patients will still pay the usual fees for provider appointments before or after the scan. So there's some cost barriers. The first step for getting a patient screened for lung cancer is having them talk to their PCP or their primary care provider. And there are actually certain questions a primary care provider will ask and topics that will be discussed. And one of these is the patient's Pacquiao smoking history. And if you want to find an accredited lung cancer screening center, you can go to the American College of Radiology's website. You can type in the city, the state to find a accredited lung cancer screening facility, and you'll be able to find the address as well as more information on that field. But of course, you'll have to go through your primary care provider first. So what are some of the benefits of low-dose CT screening? One, it is safe, it's pain-free, it takes less than 5 minutes, and it's low radiation doses. It's important to note that this is not really a process that will hurt at all because we're not using any contrast, there won't be any needles, no injections. It's non-invasive, it's fast, completely pain-free. And the radiation exposure, while there is definitely some radiation exposure, is relatively low. So another question that we asked, right? We're on the topic of lung cancer, especially among younger students, high schoolers, is how does vaping and e-cigarette use affect lung cancer? So vaping and e-cigarettes are a relatively new phenomena, and they've become more prevalent, obviously, in the last decade. While the long-term effects of vaping and e-cig use are still being studied, it's clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. And these both are elements of the e-liquid, and because of these elements, they can be really dangerous for your body. And there are different studies that have demonstrated in vitro transforming and cytotoxic activity of these derivatives, right? So when looking at the lab, these things can be extremely dangerous. Vaping causes fewer health risks than smoking, but it's not a risk-free activity. It can increase heart rate, decrease air volume in the lungs, and increase airway resistance. And furthermore, e-cig use has been significantly increasing, particularly among young adults and non-smokers, making an area of significant concern for the future. So it's definitely something to watch out for and be cautious about. And now let's talk about smoking cessation. It's very important to talk about this as well. Lung cancer screening is not a substitute for smoking cessation. In the same way, smoking cessation is not a substitute for lung cancer screening. They're both very important, and one of the best ways to prevent lung cancer is smoking cessation. And one of the best ways to detect lung cancer screening is using lung cancer screening. And so both techniques are needed to fight the disease. For every year after an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer they have. And another reason that smoking cessation is important because sometimes it's required by Medicare and Medicaid services for lung cancer screening programs. However, this can be difficult, right? Smoking cessation can be difficult. And there are a lot of resources for people trying to quit smoking. And there are different resources that definitely your medical provider will be able to provide you in order to help you through that process. So as we conclude this presentation, here's some of the things that the National ALSE organization has done. The National ALSE organization has tried to work with Congress to make sure that there are more congressional actions to make sure that lung cancer is better cared for in the population. The National ALSE organization has visited many community centers, many programs, many schools, often virtually, in order to give presentations like these to make them aware of lung cancer. And hopefully, we can make a dent in the lung cancer statistics by making sure that people get screened earlier. And it really starts with working together. So a lot of you might be thinking, okay, this seems like something that might affect someone older. Why do I care about this? Well, this is important because of the fact that we can make an impact in our communities by reaching out to family members, by reaching out to each other in order to get a better idea of what to do in these sort of situations. And so that we can work to make sure that those that are recommended to get screened do indeed get screened. So really quick here, just a couple of the presentations that Rice ALSE has planned up in the upcoming future. If you don't mind, I will go ahead and open up this floor to questions. If you guys have any questions you'd like to put in the chat, feel free to go ahead and do that. If you'd like to unmute yourself and go on the mic, feel free to do that as well. On the slideshow, you can see our social media channels as well as our websites. In case you'd like to visit those, that would be really great. And in case I don't get into any questions, if I miss some question, feel free to email me as well. I'll put my email in the chat.